Okay, so as I was saying earlier, we're going to learn how to order a controlled prescription. So obviously our Percocet is going to be an oxycodone, acetaminophen combination medication for pain. So in order to order that, we're going to order it the same in terms of just computer operating. So we're going to type in Percocet, and we want the 5-325. All right, so we can click on that. And notice here how it automatically looks different than the meloxicam. Notice here how it says Schedule 2-5 drug. Any medication that you put into Athena that is a controlled substance, a scheduled drug, will have this pop up. If this pops up, it cannot be sent electronically through this sign orders. It actually needs to be handwritten on a blue script pad. So we still need to document it into this computer, into Athena, that they've obtained this medication today, that they were written for it. However, we can't rely on the EMR system to send it to the pharmacy because scheduled drugs cannot be sent to the pharmacy electronically. So after it's handwritten, the students will show you how to handwrite these scripts the way that, we'd like them to be done, but we can edit this sig the same as we did our meloxicam. I'm going to keep it here. I'm going to say take 1 to 2 tablets PO every 4 to 6 hours as needed for pain. For this quantity, we're going to say we're actually only going to write them for about 20, just enough to get them through a short amount of time. All right. And you're also going to see some alerts down here. These are potential drug conflicts, interactions. Any severe interaction would typically pop up down here. Sometimes the pharmacy will give us a call as well if there was an interaction. For the most part, these alerts can be taken with caution. If there's anything that concerns you on there, we can obviously speak to a provider, but typically if there's anything severe, then we get notified by the pharmacy or there's an alert before we send it. So since we were talking about writing this by hand, we don't want to send this electronically. So in order to make sure that doesn't happen, we're going to click on this documentation only button. This says that it is not going to be sent to a recipient, as you can see, and this is just strictly documentation purposes. So that's how we're going to write our Percocet. So also while this patient was here, we're going to pretend like he needed a back injection. And we decided that we were going to do a trigger point. Actually, let's say we're going to do a joint injection. So to make sure I didn't forget that, I'm going to go ahead and write that down. Okay. So when we do our joint injections, they're combination injections that include dexamethasone, celestone, lidocaine, and bupivacaine. So the order of those medications is exactly how I just said it, DCLB. He'll probably, our providers will say, I want a 1-2-2-2, something like that. So those injections, to make sure I wouldn't forget that when I was leaving, I would write that down. And that's again 1 cc of dexamethasone, 2 cc's of celestone, 2 cc's of lidocaine, and 2 cc's of bupivacaine. In order to document that we gave this joint injection, we're going to do a procedure. So, this AMP is where we're going to be doing our referrals, our imaging, our medications, anything that we're sending out. But if we do something in-house, we're going to document that under our procedure documentation, and that can be found under the physical exam tab. If you scroll all the way to the bottom, we're going to have our procedure documentation tab here. So we'll click on this plus, and I would encourage you to scroll through these and get familiarized with the different types of procedures that we're going to do in the office. We do a lot of joint and bursa corticosteroid injections, a lot of trigger points, and a lot of cryosurgery. Again, in your packet, there'll be a list of the most common ones that we use, so review that. But in order to submit this information into Athena, we'll click on our procedure template, and it pops up with a procedure template. This template is important because it sends it to, it's how we communicate with insurance. There's a code, a CPT code connected with this documentation, and that's how we bill for it. So after discussing the risks, we'll put the type of injection that we're going to use. So in this case, I said we were going to do a dex, celestone, lidocaine, bupivacaine, so I'll click on that one. Notice this order was different than I said it. Dex was second, not important for this simulation, but when you do get in to the practice, you'll need to be familiar with that. So we're going to say that it was into the right SI joint. That's where we're going to give it. These are all just, if you click in the box, it gives you some options and you put what it was. So the skin was prepped with betadine. That's typically what we do, but you'll put whatever it was prepped with. Say we're going to use a 22 gauge, 1.5 inch needle, and we're going to do into the joint and a posterior approach. And then the site was injected with a mixture of you can edit anything in this template. I typically recommend, if you double click on the MG, you can actually delete these boxes and edit all of these little extra pieces. We don't really need those. So again, you can click on your dex, celestone, lidocaine, bupivacaine, and put the amounts that you injected right next to it. So we had 1 cc of dex, 2 cc of celestone, 2 cc lidocaine, and 2 cc's of bupivacaine. All right, and that is our procedure documentation. So that should be, that's how you're going to do all of your procedure documentations. Simple as that. Okay. So once we have ordered our diagnosis, if we wanted to do another one, say he was having some hand pain today, he mentioned something about that. Again, we can type in hand pain in our diagnoses and orders, click on hand pain, and we can do the same types of things as we were doing before with ordering. Notice how this care instruction popped up, so we're gonna click that discuss with patient. All right, and now you can notice that this doesn't have a red mark next to it, and this does have a red mark next to it. This is because this does not have an ICD code associated with the diagnosis. It just has that informal diagnosis. In order to add that ICD code, you're going to click on ICD code. It's asking for a laterality, so I'm going to say it was left. And then you can click on the ICD code and find the best match for that. So this ICD code is pain in left hand. Boom. Notice how this redness disappears. That's what we want. All right, and we could, if we wanted to add x-rays, medications, we can do that here on this plus mark. If we wanted to send to orthopedics, we could. Any of that kind of stuff. It's all going to be with that plus. So there are going to be some changes and some difficulties when dealing with insurances. Every insurance is different and has different requirements and where you can send people and whatnot. Again, you'll get information on this, but in order to check their insurance, you'll go up here to this drop-down bar under their name, and you can find their insurance information here. It looks like he's on a sliding scale pretty much. If it was on Medicare or commercial insurance, that's where it's going to be listed. You can also see their default pharmacy here. Our nurses go over that prior to taking them into the room, so that it should be updated, but before you send a script, always double check. And this is their contact information. So if you click on their contact information, you can see their work, mobile, home numbers. You can find their address. This is going to be important if you ever need to get in touch with them regarding lab results or anything like that. That's where you're going to find that information. Again, you can look up on this this alert, this is where important information about this specific patient is going to be listed without it actually going onto a formal note. So any information that's going to be listed over here on these tabs is something that other people have access to. This is kind of a patient-specific note section in case we needed to communicate for the next time they come in. This is where we're going to have it. If someone is HIV positive, Hep C positive, or anything, possibly there's legal issues, any of that information that would affect them in our practice goes up in this box as well. So this is where we're just going to have test patient. You won't be editing that box. That's just for your information. And same with the insurances and anything administrative up in this tab. You're not going to be editing any of that. You're just going to be utilizing it. Okay, so the last part of this is going to be our sign-off tab. So anytime you have been in the room with Dr. Marsh or one of our PAs or nurse practitioners, you're going to document as scribe, and that way next time you either come into the office, maybe say you're going to follow this patient and having some continuity of care, we can figure out who saw this patient by documenting it by scribe. So you'll click this little checkbox to say documented by, and you'll click the plus, and then you'll type your name. Sometimes it won't pop up unless you type your username. So it just kind of depends. Sometimes you would just find your name that way. Click it. And then, actually, I'll go ahead and do it so you can see what it looks like. All right. So notice how this says sign as scribe. You definitely want to click on this after you've put your name on the document, and that locks it in. Sign this encounter as scribe. And that puts my name on it. That finalizes that it was me. I can definitely undo it if I want. If say I actually didn't end up seeing this patient, I can just unclick it and undoes it. Nothing in this EMR system will kick you out. It's not finalized until the encounter is closed by the provider. So you can come back and access any part of this chart at any given time until it's closed. Typically, our timeline for that is a couple days. So obviously get it done as soon as you can, but you can access this even after you've gone back to your, even after you've gone out of the chart. So then once your patient is actually out of the building, they've left, you've sent them on their way, you've given them some instruction, then we'll check them out. And you'll just click on ready for checkout. If you click down on the drop down menu next to sign and close, do ready for checkout. And what this does is, when we talked about at the very beginning how there was different colors next to the names on the menu screen on the schedule, the blue was arriving, the orange was ready for staff, and then in that case the nurse would take back the patient into the room. So when the nurse is done with the patient and had their vitals done and everything, their initial check-in is completed, that color will turn to green. Once you check them out, it turns to gray. So that helps us manage our schedule a little bit while we're in the office. So just make sure you're checking those patients out after they're gone. Overall, if they need a note for work, you can access that in your letters, and you could actually click on that and say they needed an excuse from school. You can add it and edit it. And you can see how I did that just by clicking on the document until I got into it. Now you can edit this and print it off and give it to them so that they have an excuse for work or school. All right, and that concludes our Athena training at this time. Any other further questions will be answered by your student leaders, but I hope this was helpful.